Hi guys, my name is Anastasia Varova and I'm qualified practicing pelvic floor physiotherapist living here in sunny Cyprus, and I practice under what has become my brand name, Alpha Physio Care. And today I would like to provide you with quite short introductory video about what is pelvic floor physiotherapy, how it can help us generally in life, and how it can help you as an individual even if you never ever experience pelvic floor issues. Yes, pelvic floor physiotherapy can actually be a very useful thing to use or to know, even a person who never had any issues. I think let's begin with a little bit of statistics before I continue. If you really enjoyed this video, I would really appreciate your support with a like. Follow for more videos. I will be sharing my other experiences, professional experiences, thoughts, and practical things you can use for your pelvic floor. So, statistics. Statistics is very vast. If you look, excuse me, if you look by the countries, if you look by regions, and if you look at different research, you can have approximately from 9 to 36 up to 50% prevalence of urinary incontinence. Urinary incontinence, simple word speaking, it's leaking urine for various reasons. I'm not going to dwell in deep what are the reasons, and we're talking about both female and male. Roughly speaking, if you go to the simple Google search, you will find that 1 in 3 females will experience urinary leaks during their lifetime. Doesn't necessarily mean that it's going to be through the whole life, but there will be a period of their life when they will experience that. And approximately 1 in 5 males will experience it. With males, though, it's a little bit, it's getting more prevalent when they're getting older. So for older men, the reason is believed that purely physiological. The urethra of female is very short, and there is not a lot of space for urine to kind of travel. Therefore, it's easier to lose it than in male. In male urethra, the canal that the urine comes out is way longer. It's about 13 centimeters approximately, whilst in females 3 to 4 centimeters. So pure physiology. As we grow older, regardless of our birthing status, the physiological changes, and I'm talking about females now, the physiological changes occur and the urinary leaks might become more often. So besides the urinary leaks that might happen, there is a vast conditions that might happen with male and female that I see in my clinic. I'm just gonna name you a few and try to give my explanation of what they are in a simple terms. So for female, usually it's any post-birth trauma. It can be perineal tear, so the tear of around of the vaginal exits. It can be post-cesarean section trauma. It can be vaginismus, it can be painful intercourse. Vaginismus is a condition where women will struggle to have any penetrative action into their vagina, be it sexual intercourse, be it vaginal checkups at gynecologists, be it use of tampons. It can be generally persistent pelvic pain, burning sensations. Here I have a female model, but also the burning sensations, the pelvic pain, the anal pain, they apply to both genders and to all people in general. With the male, it can be quite often prostatitis, problems with prostate. Therefore, prostate might be enlarged, it might be pressing the bladder, resulting in the leaks of urine that is caused by urge incontinence, where the bladder contracts. Involuntary, and they have this urge to go to the toilet. It can be pelvic pain, it can be problems with erection as well that stem from the pelvic floor problems. When we checked everything, when we do blood tests and everything is fine, we start to go kind of to that area. So it's a vast majority of conditions that are under this umbrella of pelvic dysfunctions. And pelvic floor physiotherapists are the one who actually can help and be part of a management team when it comes to pelvic floor dysfunctions. For example, if you just have a simple Google search, or if you have a look of recommendation of treatment, for example, urinary leaks. Simple treatment, urinary leaks. Even if you don't put gender into your search, you will find suggestion of physiotherapy as being the first one. NICE guideline, which is National Institute of Clinical Excellence, UK, is putting pelvic floor physiotherapy almost first in conservative management, conservative being treatment without surgery, into pelvic organ prolapse. This is when your organs drop out of your or into your vagina or around that area, into urinary leaks, into pelvic pain, into post-pregnancy recovery, into pain of prostate, erectile dysfunction, sexual dysfunction. So you will find in every single guideline that is not going into surgery, because surgery has its time and place, that is going into conservative management, you will find pelvic floor physiotherapy. If you are a woman who is planning on children or had children, let me tell you that in Belgium, for example, or in Netherlands, or if I remember correct, in France as well, pelvic floor physiotherapy after birth is a must. It's paid by the country, and this is a long-term investment into the health of a female. That means woman knows how to use the muscles, she will strengthen them, and this will result in less problem in the future when she probably has more babies, when she arises to menopause, and her pelvic floor muscle becomes weaker because of the influence of the menopause. She will already be kind of aware of the importance of pelvic floor exercises, and this is the simplest thing that you can do. The male, for example, they will be aware of, and this is more prevalent in the male patients that I see. Quite often they might have a tight pelvic floor. First of all, they will become aware of generally having pelvic floor muscles, and that these muscles can influence their sexual function and generally day-to-day life, especially if you do have pain. And they will be able to have tools such as stretching, breathing, relaxation, and so on. And of course, we can cross-apply it to the both gender. So how it can help you as a person who is maybe never had problems. You'll be watching this video now for some minutes and thinking, well, I don't have any problems with my pelvic floor. Why would I even go and see pelvic floor physiotherapist and specialist? The truth is, you don't have to until you need to. In my practice, I have seen women, less men, more women who would proactively come for a pelvic floor checkup to me before becoming pregnant. Also, these women who never became pregnant and they never planned to become, and after having a baby, just for a checkup. Okay, they just came for a checkup. They had absolutely no complaints. They had a satisfactory sexual life. There were no urinary leaks. There was nothing, and they just proactively came to me, and we still had things to talk about. We talked about fitness and how they can ensure that whatever they incorporate their fitness routine, it does not strain their pelvic floor more or doesn't cause any potential damage, especially in those early days post-pregnancy, post-birth. We can always discuss any issues if they are a little bit scared or maybe worried about getting back into the intimacy, what can be done about this, and generally establish very simple routines that they can incorporate in their life to take care of their pelvic floor. Like, you brush your teeth every day, you don't think about it much, you just do it, I don't know, 2 minutes a day, you're done, twice a day. Same thing for the pelvic floor. For a person who never experienced any problems, just to raise awareness, just letting them know things they can do not to get things worse, and just establish a simple routine into your daily life about the pelvic health. I think, let me just tell you a few words about how the whole physiotherapy concept works, and then we can wrap up. So you can come for a checkup, and usually this checkup might involve intravaginal or intrarectal assessment. That means I'm actually will get my gloved finger inside your rectum, your vagina, depending on the gender and depending on the things we want to check. However, this is not exactly necessary. We can just talk things through, especially if you don't suffer from any particular issues. We can talk things through. We can do things you being clothed. You can just give me your feedback about what you're feeling, and that will be it. If you do have any certain complaints, then we can always discuss how we progress with assessment, but I think that will be a topic for my next video. So I think I briefly told about how pelvic floor physio can benefit you. So remember, 1 in 4 women, 1 in 5 men, sometime in their lifetime, will experience leaks. So potentially, if you share this video with 5 of your friends, for one of them, this actually might be a discovery that there is something they can do about it, and they don't just have suffer in silence. Thank you guys for being with me. I really appreciate it, and I will be happy to share my thoughts with you, my knowledge with you, and we see you all later. Bye bye.